Hey guys, Tony Maritato here, licensed physical therapist. And I know it doesn't always seem like it because it takes me forever to get to your comments on YouTube, but I do greatly appreciate them. And I do my best to read as many as possible. This one stuck out because this is something that I'm dealing with for two other patients in my clinic right now. So I wanted to take a minute to record a video on the topic. So I'm going to go ahead and read Sandy's comment here. You might not be able to totally see it because it's so small. But Sandy basically says, "Hi Tony, I had my right knee replaced on October 20th, 2021. So today is November 8th, 2021. So we're looking at about 18 days ago. Surgeon used the muscle sparing technique using robotics. Awesome. It's great to know. The problem I'm having is in my right groin. It's killing me. It hurts when I try to lift my leg." That's a really common scenario. So it's a right knee replacement. She's experiencing pain in the right groin when she tries to lift her leg, like a straight leg raise or hip flexion. I'm guessing, Sandy, it's probably when you're getting in and out of a car, maybe when you're trying to lift the leg to get out of bed or move over to the side. So she goes on to say, "The groin has been bothering me for probably the last year or so. I saw a surgeon in February of 2020. So it's been going on a long time. This isn't something that just happened with surgery. At that time, he said I was bone-on-bone arthritis in my right knee and I would need a replacement. That's what you had done. I thought once I had my knee replaced, the pain in the groin would go away. My current surgeon saw a current x-ray of the right hip and said everything looks fine." And that's the thing. So looking at the implant, looking at the replaced hip, anatomically, I'm sure everything is fine, but what doesn't show up on the x-ray is the soft tissue, the muscles, the tendons, the ligaments, the connective tissue, and that's most likely where you're having the problem, especially with the fact that you said it's when you're trying to lift and move the leg. So I'm going to get into more detail, but let me just finish reading this out. So I was thinking maybe something went wrong with my artificial hip. Any suggestions as to what to do next? Chiropractor, PT, family physician. It's really slowing my recovery from the knee surgery. So Sandy, that's not uncommon. Like I said, I literally have two patients in my clinic right now who are basically dealing with the same thing. I think first thing we need to do is we need to really clearly understand what is the exact movement that's producing the problem. Can we control that sensation, the sensation of pain that you're having with different foot and ankle positions? So I'll give you an example. Sorry, you guys hear Tucker in the background. I'll give you an example. So I had a patient who just had hip surgery. It was not a hip replacement. It was a labral repair. And she noticed that when she walks, she had pain in the groin anterior hip. It was on the side of surgery. She was concerned about that. So I recommended that she try to turn her foot in as if she was kind of pigeon-toed, or turn the toe out to see if it changed anything. Not that we're going to make her walk like that, but just to see if that alignment variation changes the sensation. Sandy, to you, I would say the same thing, or anybody who's feeling a pain in the front of the hip or the groin. What we want to do is we want to change the alignment. So maybe you try to lift your leg and you feel pain, but you don't think that you're doing any kind of damage. So then you turn the toes in, you turn the toes out, you bring the foot away from the midline, you bring it toward or across the midline. You try these lifts in different positions, and what I expect you to find is that maybe a combination of rotating and angling the leg out when you lift eliminates the sensations that you were feeling. That, for me, as a physical therapist, at least gives me an idea that if I make some mechanical changes to the alignment of the structure, I can affect the sensation that the patient is feeling. And then we want to try to dive in to say, well, what is it that I'm feeling exactly? So behind me on the screen, I'll try to zoom in here. I've got some anatomic pictures up. And so, like, just randomly, if I come in here and I take a look at one of these pictures, what I'll do is I'll get this large on the screen so that my head's not in the way. So for example, this is the front of the pelvis. This is the lumbar spine from a forward view. This is the sacrum. This right here is the top of the femur. These muscles would be considered hip flexor muscles. All of the other muscles, tendons, ligaments, all the other structures have been kind of moved away. But what I wanted to show you was, so when I go to flex or raise my leg, like I'm going into the car, or I'm going up a step, or I'm laying in bed and I want to lift my leg and bring it out to the side of the bed, what's happening is my hip flexors, which are big, big, powerful, strong muscles, are contracting and pulling. And if you can see this white line that's right here, that is a thick ligament, and that ligament could be pinching or compressing on the muscles of the hip flexors that are actually lifting and moving the leg. The fact that you might not have pain in the hip when you press down, but you do have pain when you're lifting up, is consistent with some sort of impingement or some sort of pinching or pain. If you told me that you're getting a lot of clicking and clunking deep in the hip socket, and you have a deep throbbing aching pain deep in the hip socket, I would be thinking more that perhaps there's some problems going on with the labrum. So the labrum is a thick connective tissue that runs around the socket of the hip. It makes the joint surface, it improves the contact area of the joint surface, basically makes the socket a little bit bigger so that it can hold the hip, the head of the femur in the hip joint a little bit better. But you could have tears, you could have damage in that. But that's usually more consistent with like a clunking or a deep, deep throbbing aching pain, and it's not necessarily only when you're flexing or moving the leg. That doesn't sound like what you're describing. If it was true osteoarthritis, which is impossible for you because you've had a hip replacement, but if somebody else watching this video thinks, how do I know if I have hip osteoarthritis? That is more consistent with deep groin pain. But again, it's an uneven joint surface. A lot of time there's clicking, popping. It's a sharp stabbing pain. You get pain with different motions like flexion, extension, abduction. Sometimes your range of motion is significantly limited. Again, you can't have osteoarthritis kind of pain because the joint surfaces have been replaced. So my best guess, and this is where you would now take your situation with this information, and you would go see a therapist, a physical therapist, maybe a chiropractor. Everybody's going to be different. There's great therapists, not so great. There's great chiropractors, not so great. I have no biases in this. But what I would say is you want somebody who's going to take the time to really analyze what's producing the symptoms you're feeling. How do we quantify and qualify the kind of pain that you're having? Do I think it's muscle, tendon, ligament? For example, if you laid down and somebody was able to lift the leg for you and you had no pain, but then if you tried to lift the leg by yourself and you had pain, this would be consistent positive test for possibly something going on with the musculature. Because when somebody else lifts your leg, the muscles aren't working. When you lift your leg, now the muscles are working. So there's different ways to test different structures, but once we determine, is it labrum, is it muscle, is it ligament or tendon, is it connective tissue, joint capsule, do I have an impingement going on, do I think maybe it's a referred pain coming from something else? Once we narrow that down, and there's no real good way to do that with imaging, even if you went to the next level and had MRI or other kinds of imaging, it still in and of itself can't tell us what's going on. So from everything you've shared, if you were my student, physical therapy student, and we were kind of teasing out what we think might be going on in the case, I would lean toward, it sounds like potentially something soft tissue. The fact that it's been going on over a year makes me think that it's probably something more ligament or tendon rather than muscle. Muscle tends to heal more quickly. Ligament, tendon tends to stick around for a lot longer of a period of time. The fact that you had your knee replaced and it didn't change anything makes me think even further it's probably some sort of, connective tissue problem that probably would benefit from being addressed directly, certainly in the clinic. So for the patients that I have right now who are dealing with this exact situation, they're on a regimen of we're strengthening the musculature around the site of pain without exacerbating the pain. So we're finding all the things that they can do without increasing pain. that allow them to improve circulation, improve tissue healing, get stronger through the joint without making it worse. Then we're looking at what positions we need to achieve when we're doing certain things. So in other words, if I've got somebody right now, she couldn't get in and out of a car the way she was doing it before because her hip hurt so much when she would try to pick her foot up into the car. So I showed her a little way to twist the leg and rotate. Now she gets in and out pain-free. It's a temporary solution until the pain is resolved, but for now, it's allowing her to do the things that she needs to do without dealing with the frustration of pain. So my recommendation would be find a great physical therapist in your area who's willing and able to spend the time with you to really assess what we think is going on and go in with the intention that this is an investigation. It's not a clear-cut black and white, this is the problem. We need to tease out some details. We need to figure out why this hasn't gotten better on its own. Maybe they'll look at footwear. Maybe they'll look at alignment. Maybe they'll look at some biomechanical stuff. But regardless, a great detailed assessment with a physical therapist or somebody who's willing to look at the big picture of when did this start? How did it start? What makes it better? What makes it worse? What have you tried already? That's where the answer is going to be. And in all honesty, what's probably going to happen is whether you find the right person or not, at some point down the road, all of a sudden you're going to realize this pain is gone and you don't even realize when it went away, because that's what tends to happen with a lot of these things. They come out of nowhere and they disappear out of nowhere. What we want to try to do is try to keep them from interfering with your life and frustrating you while you're dealing with it. All right, Sandy, thank you so much. And anybody else who wants to ask questions, I will do my best to answer them and share the information. But remember, this is all educational only. This should never be considered medical advice. You have to be examined by a medical professional before you decide what to do next. I'll catch you guys on the next video.